Thank you, Stephanie. So, Dr. Emily, I am a functional podiatrist and a human movement specialist, which means that I look at the feet from a very natural integrated perspective. I actually get a lot of my patients out of their orthotics and their supportive shoes. Of course, if they need orthotics and different types of footwear, I recommend that. But I always add a layer of exercise and natural foot function. I'm big on sensory stimulation and that component of foot health. And I also very much appreciate how the feet are connected to the rest of the body, specifically the pelvic floor and all the way to the tongue. And then, of course, I'm the founder of Naboso, which I'm sure we may chat about a little bit.
Yes, definitely. Okay, yeah, cool. So I got a ton of questions. I think the biggest one was about bunions. And every time I post about the feet, I always get questions about bunions. People wonder, is there anything you can really do to help bunions? Like, do you just have to have surgery, or is there some other way, you can treat bunions?
Yeah, bunions, those are definitely one of the topics that people ask all the time. And there's a lot of misconception around what causes bunions. Do shoes cause bunions? Can you reverse bunions without surgery? So what I would say, just to kind of start to set the tone, and then we can get into it a little bit more, is I try to never blame bunions on shoes. I want it to be much more that there's this understanding that foot type and oftentimes a ligament laxity or an instability of the foot is really what predisposes that individual for bunions. And then the continued movement on an unstable foot can essentially then cause the bunion. Bunions are actually not a big toe issue. They're actually further down in the foot. There's a joint, it's called the metacuneiform joint, but it's more towards the middle of the foot. That's actually where a bunion occurs versus in the big toe, which is why I don't really blame shoes on bunions. Right. And then to kind of again set the tone is bunions cannot be reversed without surgery. I wish that they could be. And if I figured out a way, I'm sure I'd be sitting on a beach drinking a pina colada, but there's no way. But what I tell patients, and I know you believe in this as well as a physical therapist, is that we can push pause on our bunions and we can strengthen the foot and we can use things like toe spacers to try to support that natural alignment to again slow the progression of the bunion.
Okay, yeah. I get a lot of questions about toe spacers too, and I know I've shared them a lot, and people ask, do they really work? What do they help with? You just went over, they help with bunions, and that's usually what I tell people, but they help with more than just bunions. So I guess kind of answer that question, like what all do toe spacers help with?
Yeah, I love toe spacers. I'm obsessed with them. And honestly, I was recommending these to patients way before Naboso started selling toe spacers because they're just so easy. They work. They're a very passive way to recover your feet that you can just slide them on at the end of the day. But if we're thinking specifically conditions, foot conditions that toe spacers are beneficial for, of course, bunions. Right. Hammertoes, neuromas. So it's beneficial for a neuroma because you're opening up the front of the foot where you have all the tiny little ligaments and muscles. Right. So you're spreading that. One that the listeners might not be aware of is plantar fasciitis. And how toe spacers help plantar fasciitis is that our plantar fascia runs from the base of our heel across the arch, and then it splits and it inserts into all 5 toes. So because it comes into the toes, when you stretch and splay the toes with the toe spacers, again, you're essentially stretching the plantar fascia. So it's one of my favorites. Of course, your plantar fascia blends into your Achilles tendon. So you could say, okay, Achilles tendonitis, really good to do that as well. But yeah, toe spacers, you can wear them in your shoes. You can wear them around the house, walking around, depending on the style. Some styles you can't walk around in. Easy to wear all day. I actually consider them a balance tool as well. And that's one that the listeners might not be aware of, that our toes are really, really important to balance. So if we have decreased balance because of neuropathy, stroke, some sort of neurological condition, or just age-related risk of falls, using toe spacers supports long, straight, flat digits, which is an important part of how we maintain balance.
Okay, yeah, that was great. So talking a little bit about plantar fasciitis, I know I post a lot about it just because it seems like almost everyone has had plantar fasciitis at some point in their life, or sometimes people have it for years and just can't seem to get rid of it. I know clients I see now, clients I saw in the clinic, it was always a frustrating thing. Like, oh, I've tried everything. I can't get rid of this plantar fasciitis. So the toe spacers definitely help, but do you have any other tips that you give patients you see that have plantar fasciitis?
Yeah, so with plantar fasciitis, what I often tell a patient that I'm seeing for it is really understanding and classifying the plantar fasciopathy, we could even just say, is what type do you have? Meaning, is it acute or chronic? Because I know you know, but oftentimes,
Right,
listeners and patients don't really understand tissue injury and
right.
tissue repair. So just for the listeners, is an acute plantar fasciitis flare up, let's say, is it's more naive tissue that has been irritated. So we have little injury, and then the body is essentially creating a repair response that does have an inflammatory cycle. It's trying to repair the micro tears, and that's essentially the pain and the sensation that you're feeling. Now, if that happens over and over and over, or it goes quiet and then it shows face again, and then it goes quiet and then shows face, or it just persists for, let's say, a year straight of heel pain, you start to get these chronic changes of the tissue. And I'll tell my patients it's kind of like this disorganized haystack, like it's just this chaotic pile of tissue that you're trying to demand of it. You're trying to make it move like a rubber band, but it's this chaotic haystack, which
Right.
means you just essentially keep re-injuring it. So just doing something like releasing the foot, of course, I love the neural ball and the toe spacers, but if you have chronic plantar fasciosis, so the neural ball, if you have chronic plantar fasciosis and you have this disorganization, the tissue is actually very fragile and you can tear it. So we might be dealing with something that's not really plantar fasciitis. It could be a partial tear of your plantar fascia. So I always like to just kind of really understand what's going on, then have a better game plan for the patient. Otherwise, they just kind of spin their wheels, and we want
Right.
to first, is it acute, chronic? If it's acute, right, I'm sending them to you because
Yeah.
you're going to help strengthen the feet, get the
Yep.
mobilization, focus on the rest of the body. I typically see the chronic patients, and then in my office, I do regenerative injections, and I
Okay.
try to bring organization to that chaotic environment.
Okay. Yeah, that's helpful to know for me as well, because I know I've had a lot of patients that have been super frustrated and have done PT over and over for years and just haven't gotten any relief no matter what they've tried. So yeah, that's definitely very helpful. Another question I had was about foot swelling, just chronic foot swelling, and what could cause that, or how could you get rid of that?
Yeah, so I think anything with the foot is connected to the rest of the body. So
Yep.
it's okay, why do we have this? Is it in one foot or is it in both feet? Right? So we just
Right.
want to step back. And for the listeners, if they're assessing themselves, is step back, okay, is it the whole foot? Is it both of my feet? Well, now that's starting to make me think something systemic, like with the
Right.
lungs cardiovascular, right? What's going on
Yep.
with that? Is there an imbalance of how their lymphatic system is functioning, right? So that's again thinking
Yep.
bigger picture, systemic. If, let's say, because I've seen this, you have an ankle sprain, and I know you see a lot of ankle sprains in your practice and through what you do on social media, is if you have an ankle sprain and it persists to swell, just that one side, end of the day, some of that could be, is there something that's missed perhaps? Sometimes we can get, here's your ankle joint, and you can get a little bit of a defect on the cartilage. It's called an osteochondral defect. Maybe there's something that's missed, and that's what's triggering that essentially inflammation, end of day inflammation. I love Normatec boots or something like that to really support the circulatory system. Sometimes it's just sedentary, and it just means we need to activate our second heart, which is our calf, and you have to get those ankles moving to get the blood moving. So that's where I always look at things with my patients from a fresh perspective. I try not to come in biased and think like, okay, right away it's CHF, right? As soon as you say foot swelling, I'm sure anyone's gonna be like, oh, it's CHF, right? Something where it's like with the heart and the lungs. So stepping back, thinking, very outside of the box and seeing what we could essentially come up with.
Okay, yeah. Yeah, I also had some questions about shoes. I get a lot of questions about which shoes are best for me, which obviously everyone's different, so that's a hard question to answer. But I guess if people are having foot problems or pain in their feet or bunions, are there any specific shoes you would suggest, or suggest a place maybe that they might go to get fitted for shoes?
Yeah, so with the footwear, what I would say, because again, I'm trying to answer things that all the listeners get these key takeaways as much as they can. So when I look at footwear, I always determine it based off of three things. So your foot type, right? Do you have a high arch, neutral arch, flat foot, etc.? So what's your foot type? Second is going to be, what is your injury history? Do you have bunions, as you had mentioned? Do you have a neuroma? Do you have chronic plantar fasciitis? Or do you have absolutely no injuries? And that's essentially the second factor. And then the third would be, what is the activity or the demands you're going to put under the foot, right? If we're talking about running a marathon, well, that's a different conversation than someone who wants a pair of shoes just to lift at the gym, right? Very different. Or if, let's say, someone stands on their feet, like a nurse, right? A nurse who's on her feet, his or her feet for 10, 12 hours straight on concrete, different conversation. So that's how I look at it. Now, most footwear that I like is natural. Wide toe box, zero drop, minimal cushion. That's like a Vivo Barefoot, Zero Shoes, Lem. So these are some of the popular brands. If someone needs a little bit more structure, maybe something like an Ultra, On, kind of in that category. And then there is a time and place. I'm sure some people are going to be like, oh my gosh, where I will recommend a Hoka. Some people are surprised that I'm actually saying that. But what I like about Hoka, even though they have a big old stack of cushion, is that they have a rocker. So you rock through the shoe versus trying to rock through your forefoot. So if you have arthritis in your big toe, I saw someone typed in, what about dorsal spurs? So spurs on the top. You can get spurs on the top of your big toe joint. That's very painful. It causes limited range of motion. I may recommend using something like a Hoka so you roll through the shoe. Neuromas, anything with the second toe, metatarsalgia. So this is where you could think of like a Hoka. Again, it's a lot of stack, so I try to bring sensory into the shoe with the Naboso insoles and stuff. But yeah, so that's how I would start to explore footwear.
Yeah, that's very helpful. I also had a question about sandals. Do you ever recommend sandals or a specific type of sandals?
Yeah, I live in Arizona. It's 110 degrees right now. So I wear sandals every day, or I'm barefoot. But yes, so bigger picture mechanically. So when we walk, the way that we walk, you want a sandal to be attached to your foot. Actually, just in general, a shoe should be attached to your foot. Now, if it's not, think like a slide. You either have to drag your feet or you will contract your toes to try to carry the shoe when you pick up your foot. Or some people do, I call it flip-flop foot, and they'll swing their leg around like this. And I used to see it all the time in New York City, and they kind of circumduct their foot to carry the sandal or the shoe around. So like Zero Shoes as a brand. Zero
Okay.
Shoes has a sandal that hooks around the foot and the ankle.
Okay.
Ortho Feet is a company that I work with, and they have various different types of orthopedic shoes that have great features for bunions, foot arthritis,
Okay.
neuropathy, all these things. They have really good sandals that attach to the foot.
Okay.
So just bigger picture, you're looking at a sandal. I don't get excited if a sandal's flat and doesn't have arch support because
Yeah.
your foot is designed to support itself. We don't need arch support. Some people do, but not everyone.
Okay. Okay. Yeah, that's helpful. I also saw a lot of patients in the clinic who had injuries from wearing flip-flops. So
Yes.
I don't usually recommend flip-flops either. Yeah. Okay. Somebody asked about metatarsal arthritis or metatarsal pain in general. What would you do for that, or what would you start with?
Yeah, so my guess is that they're describing what's called metatarsalgia.
Yeah.
Metatarsalgia is essentially similar to saying you have low back pain, right? So low back pain is, as you know, and everyone knows, that's not the diagnosis, right? It's just saying I have pain in my lower back.
Right.
So metatarsalgia is very similar. It's saying I have pain in the ball of my foot. Now, is that under the first, which could be your sesamoids? Is it under the second, which could be the plantar plate? Is it under the third, fourth, fifth, which maybe is a neuroma, right?
Right.
Maybe, so we have what's called a transverse arch in our foot, which is shaped like this. Sometimes the ball of the foot, the metatarsal heads can drop, and you can actually get just one that drops. Typically, a metatarsal will drop, or you will get downward pressure when you have hammer toes. So a hammer toe causes a retrograde pressure underneath the foot, and that can cause metatarsalgia.
Okay.
So I try to always look at and say, okay, under which met head, under which part
Right.
of the ball of the foot? If it's diffused, like the whole ball of the foot, then that may be that they've lost the transverse arch. I have one of my favorite foot pads. It's called a metatarsal pad.
Okay.
And I love met pads. And you would just put it on the foot here. It's kind of shaped like a triangle. And it'll lift you off of your met heads.
Okay.
There's a company called Hapad, Hapad. Really, really good foot pads.
Okay.
And you, of course, can find all this stuff on Amazon also. That's one of my favorite foot pads.
Okay. That's good for me to know too. I did not know that, but yeah, that's very helpful. Okay. So also, I had a lot of questions about hammer toes. I know you've discussed that a little bit, but what if someone comes in with hammer toes or pain from hammer toes? What would you do, or what would you recommend?
Yeah, so when I look at hammer toes, I always, so I want to look at and say, are they flexible or rigid? I like to
Okay.
classify and just really know what we're talking about here. If they're flexible, that means that, let's say the toes are contracted here, but you can pull the toes straight. They'll go straight, you let go, and then they contract again.
Okay.
That's still flexible, which means it's sitting within the soft tissue, like it's the tendons that are
Okay.
too strong. Whereas, let's say the toes are contracted and you try to pull them straight and you're like, it's not
Right.
moving. That's obviously rigid. That's in the bone
Okay.
now. That just helps the listener, the patient understand, okay, are these reversible or not,
Right.
right? And that just starts to guide it. Now, things that I like, of course, toe spacers. Gotta be toe spacers. Toe spacers are great. Toe spacers may not reverse the hammer toe, but does it create more space? Does it create a little bit better alignment? Because remember, our toes are for balance. Our toes are part of how we become a lever. So every time we take a step and your foot goes kind of in a high heel position, that's called a rigid lever, and that's how you release energy. You catapult forward. The shorter your toes are, the shorter the lever, which means less energy. So you work harder than you need to when you have hammer toes because you're shortening the lever. Of course, there's surgery. If you do surgery, I do consulting with patients about guiding them to understand the surgery. I don't do surgery anymore. I only do functional and regenerative podiatry, but the surgery in certain cases can be beneficial, depending on the age and essentially how painful that they are.
Okay, yeah. I guess I know I've shared a lot of Naboso products on my page and people seem to like them a lot. So I guess what are your like top products from Naboso that you like to recommend to people?
Yeah, and if people have not seen Naboso on your page, which I don't think is possible, but if not, or if they've wondered, okay, why is Stephanie using those
Right.
products? Is they have all these tiny little pyramids on them, and those pyramids are stimulating a very specific nerve in the bottom of the feet, which is a similar nerve that you find in the hand. And when we read Braille, so when your finger reads Braille, Naboso is essentially stimulating that same nerve. It's called 2-point discrimination. So can you just feel that there's different points is what it's doing. Now, of all of the products, they're very much focused around foot awareness. So can we feel our feet? That's the first step. If you want healthy feet or strong feet, strong movement, you have to feel your feet.
Right.
So a lot of our products are based around that. So the Neural Ball, which I know you've shown on
Yeah.
your page, it's the ball that splits into 2 pieces. That's one of my favorites. I often will tell people, release your feet every morning, evening, do it when you brush your teeth. That is, if you could only do one thing, that is the most important thing you can do for your foot health or really your whole body health from a movement perspective is to release your feet. Second, I'd probably say our socks. These are the toe socks. We don't have just toe socks, but the socks have the texture on the inside as well. To me, they are one of the easiest way to recover your feet, to bring circulation. I like things that are passive, which means you can cook dinner and recover your feet at the same time. You can brush your teeth and release your feet at the same time. I'm very very into efficiency. And then I would probably say the toe spacers as well. So those 3 products really just set you up for foot recovery in a way that is, again, easy to incorporate.
Yeah. Okay. Yeah. Good to know. I love all of those, and yeah, probably everyone on my page knows it because I share all of those all the time. But yeah, I guess we talked about a lot. Oh, one more thing I wanted to talk about was neuropathy. I get a lot of questions about neuropathy, and I know I've shared that a lot of the products, Naboso's products, help with neuropathy. But I guess, do you have any insight on how you treat neuropathy or how you kind of tell people how to treat it?
Yeah, I would say a different approach with neuropathy as a functional podiatrist because I don't want to just tell patients wear shoes, never get out of your shoes. I mean, honestly, it's a fear-based way to approach it, and I don't believe in fear-based medicine where it's like, oh my gosh, you might step on something and you could lose your foot.
Right.
Like that's not the message I want to put
Right.
across to
No.
people is, okay, we are diagnosed with neuropathy. Maybe it's chemo-induced, diabetic, idiopathic small nerve, doesn't matter which type it is decreasing the awareness and the connection to your feet, your foot, ground, posture, movement, right? So how can we help you feel your feet more? Of course, that's where Naboso comes in, but I also want them to get out of their shoes in a controlled environment where we make sure it's clean, there's nothing that they're going to step on or hurt themselves,
Right.
and stimulate those nerves. One of my other favorite ways to stimulate the feet is vibration platforms. And I have a power plate in my office. I see my patients over there. I have a whole body vibration platform, which is really, really good to wake up the nerves, wake up circulation, strengthen the muscles so that you essentially have to push the neuroplasticity of the nervous system, just like we do with the brain when it comes to the peripheral nerve, and then teach them how to use other input systems in their body to control their movement. I will say that the next most sensory rich area of the body, which controls posture, is actually your thoracolumbar fascia. So we access that big fascial band when we're trying to control our center of mass, and it's helping people to connect to that and feel that.
Okay, yeah. And I know I said one more, but I did remember you talked about how the feet are connected to the pelvic floor, and I've done a lot of pelvic floor therapy as well, and I kind of love that. So I want you to kind of go through how it connects, because I know most people are probably like, what? How in the world do the feet connect to the pelvic floor?
Yes, yes, yes. So our feet are connected to our pelvic floor, and it actually continues to your diaphragm and to your tongue. So I will teach people what I call foot to core sequencing, or toe to tongue. And one of the easiest ways to access this, and the way that they're connected, is through fascia. So it's called the deep front fascial line, is the fascial line that we're accessing. One of the easiest ways to connect this is through what's called a forward lean. And I'll describe this quickly for the listeners. Is so if they were to stand up, and if you want to stand up as I'm talking, and you stand up and your feet are shoulder width apart, and you start to set your base by finding your foot tripod, spread your toes wide, place them back down on the floor, and then you're going to stand nice and tall and imagine that you're stiff as a board. Stay nice and tall, stiff as a board, and then you're going to lean your body forward. Think like a ski jumper, how they lean forward, or Michael Jackson, lean forward. And then, so ever so slightly, and then come back to a vertical position. So lean forward, go vertical, lean forward, and you're essentially doing this forward lean or a forward rock. Every time you lean forward, you should feel that your toes are pushing into the ground, like they're anchoring. And that anchoring is essentially a postural reflex, so the listeners don't have to think or do it consciously, they just reflexively do it. So now to get to the rest of the body is, can you lean forward, and every time you lean forward and your toes anchor, can you exhale your breath? So now you're using the diaphragm to connect to the toes. And then you come back vertical, and that's where you would inhale. Exhale, lean forward, inhale, come back vertical. That's essentially the pattern. Okay. Now, can you do this exhale, toe anchor without leaning forward? So you're just standing nice and tall, inhale, exhale, and as you exhale, just push your toes into the floor, stay nice and tall, and then release your feet, inhale. And you're repeating it that way.
Okay.
The tongue, so instead of the exhale, you could do your tongue, and the tongue would go to the palate. So let's say you're leaning forward again. Every time you lean forward and your toes anchor, take your tongue and push it to the top of your palate. And essentially that's a way to access it. Now, just really fast, the real world way of doing this then would be, let's say you are at the gym and you're doing a squat, or you're doing a squat with you as part of, let's say, the therapy or the rehab. Okay. I would say, okay, we're here, we have a good base, we inhale when we go down onto the squat. Before we come out of the squat, I want to push your toes down, put your tongue to your palate, and that's how you come out of the squat. Okay. So you actually incorporate it into an exercise. That is the 1 minute explanation of it. And then I have videos. I have lots of videos on YouTube that go into it. What I will say is it is magical in a cheesy way. Yeah. But when you learn to access these pathways in the body, it really, really changes the way you look at posture, movement, and strength. So yeah, I hope the listeners go explore more.
Yeah, me too. That was great. Before we end, is there anything else you think I missed or you wanted to share?
Yeah, I'm going to leave with my foot release reminder. Is if you don't do one thing, just start by releasing your feet every day, because it really starts to build that foot habit. And unless they're working with someone like you who's looking at the body very integrated, most people are not going to hear this from their traditional Western doctor, that like, oh, your knee hurts, look at your feet, your back hurts, look at your feet. That's not something that's typically mentioned, unfortunately. So it's just
Yeah,
your feet are connected to
they
everything.
are. Okay, well, great. Well, thanks for coming on here. I hope all of the listeners learned a lot from this, and hopefully they start releasing their feet and working on foot strength.
Of course. Can you remind them your code for the Naboso?
I can. It's all capitals, Dr. Steph. So yeah, DRSTEPH.
Yes, good. So if you want a discount, use that
Yes.
code.
Yep. Yeah, and I have it all over my page too. So if you want to go to my
Awesome.
page and look at all the products, you can. Okay,
Yay.
but yeah, I think this was great. Thank you so much.
Of course. Thank you. Thank you so
All
much.
right. See you,
Bye.
everyone.